Hello Courtney, I'm Dr. Silverberg. Welcome to my podiatry office.
Hello, Dr. Silverberg. It is very nice to meet you. I read many great reviews about you on Google.
That's great, Courtney. I see you wrote down that you are having a problem with bunion pain. Please tell me a little about your problem.
Well, doctor, I am only 28 years old and my bunion hurts all the time. I have pain when I walk and work out. I have pain when I wear my cute shoes, especially my high heels.
How long has this been going on for?
Well, doctor, it has been happening for at least 6 months, but it has gotten worse over the past 2 months. The pain limits my activity and exercise. I can't wear my heels. What can you do for me?
Well, Courtney, first of all let me examine you and take some x-rays. I see you have arches that collapse when you stand up. People with flat feet get bunions. When your arch collapses, your big toe cannot move through its proper range of motion. This causes the big toe to get pushed to the side as you walk, run, and work out. You see, bunions are hereditary in that people are born with feet that flatten, but not necessarily that big bump sticking out the side of your foot. Improper fitting shoes make it occur a bit faster, but it's mostly hereditary. Now that I've explained why you got the bunion, are there any questions?
No, Dr. Silverberg, you explained that very well. Can you show me my x-ray now?
Sure, Courtney. Here you can see that the great toe joint is out of alignment such that the big toe points toward the second toe. Also, you can see the metatarsal bone, the bone behind the big toe, has moved from being parallel to the other ones, out, and to the side. This is the big bump you see on your foot. You see, the bump is not a growth, but rather the bone has moved in this direction. The good news is that you came in for a consultation early and did not wait too long and get bad arthritis in the joint. Some people wait too long, and then once the arthritis is bad, I have to do more invasive surgery to fuse the joint or put in a joint replacement. Luckily for you, this does not apply to you. Any questions so far, Courtney?
No, doctor, you explained that really well. I really understand. So, now will you tell me about the treatment options?
Well, Courtney, first of all, let me tell you about the non-surgical options. Obviously, the only way to get rid of the bunion is through surgery, but first I'll tell you about treating the pain that you are having and how to slow down the progression of your bunion. As I'm sure you figured out already, wearing proper shoes is important. When you are having painful days, some prescription or over-the-counter anti-inflammatories will help. Sometimes, I give cortisone-type injections into the big toe joint to alleviate the pain. This lasts anywhere from a few days to a few months, but is a temporary fix at best. Now I will tell you about the surgical options.
Okay, doctor, I'm ready to hear about it. I'm a little nervous about having surgery.
Don't worry, Courtney. I will explain everything to you and make you aware of everything you need to know so that you can make a decision. This is called elective surgery because you choose if and when you have it. I tell people to have the surgery if and when they get to the point when they are regularly in pain with normal activity. I also tell them it is time for the surgery when the pain limits the activities that they are able to do, or if the pain limits the shoes that they are able to wear.
Well, doctor, I think that I am at the point where I need the surgery. Please tell me more.
Okay, Courtney. The surgery is done as an outpatient. This means that you do not stay overnight, but rather go home the same day. You will be given anesthesia from an anesthesiologist. This is not general anesthesia, however, you will be asleep for the procedure. You will not hear any saws or feel any needles. This is called in layman terms, twilight sleep. You will be very comfortable.
Okay, that sounds good so far. Please, tell me more.
The surgery takes me about 45 minutes to do. I make an incision on the side of your foot. I like to put the incision over here on the side of the foot so you cannot see the scar when you look down at your foot. Then I will cut the bone and move it into place. I use a small titanium screw to hold the bone in place while it heals correctly. Once I'm done moving the bone, I will do a plastic surgery type stitch that goes beneath the skin and absorbs inside. This will make the scar as nice as possible. Occasionally, I will do some plastic surgery type skin flaps in order to reduce the amount of extra skin that was covering the large bunion.
Wow, it sounds like you do a very cosmetic job, so it looks good and feels good after.
Exactly. I will put you in a bandage and give you a boot to wear. You'll need to keep your foot dry for 10 days after the surgery. I can give you a shower bag for that. You'll wear the surgical shoe or surgical boot for about 4 weeks after the surgery. I will see you weekly for follow-up. I will give you painkillers and antibiotics to take after the surgery. Some people have no pain at all, and some people have a lot of pain. Most people have some pain, but not very much, and the painkillers work very well for this. After the 4 weeks in the surgical shoe or boot, you will be able to fit into loose-fitting shoes or open shoes in the warmer weather. Most people wear the loose-fitting shoes for an additional 4 weeks before they're able to fit into the regular shoes. At around 8 weeks, you're able to do moderate exercise, including a stationary bike, walking for fitness, and possibly the elliptical machine. At this point, your bone will be mostly healed. You can slowly start increasing your activity at this time.
That's good to hear as I work out regularly. I look forward to running again without any pain.
Occasionally, I will refer you for physical therapy in order to get increased range of motion of the joint where I operated. Most insurances will cover the whole thing, including my services, the surgery center facility charges, and the anesthesia doctor's charges. That is about all. If you want the surgery, you will need to come back and see me one more time for a pre-operative visit, where I will draw your blood, give you prescriptions, and post-operative instructions. If you think of any questions, feel free to call me, email, or just write them down and ask when you come back.
Well, doctor, thank you so much for taking the time to explain everything in such great detail. Your Google review said you always took your time to explain things in detail, and you did not disappoint. There were also so many patients that wrote that they had little to no pain after the surgery and that their feet looked and felt great. Although I'm nervous about having foot surgery, I feel confident that you are the best doctor to do it. Thank you so much.
You are very welcome. It was a pleasure to meet you, Courtney. I look forward to seeing you again soon. If you decide that you want the surgery, please try to give me as much notice as possible. My surgery schedule fills up very quickly as I have people from all over the country come to New York to have this surgery done by me. Feel free to browse my website at www.cityfootcare.com or call me at 212-871-0800. My email is cityfootcare@gmail.com. Bye.